Hi, everybody. Welcome to Mouth Matters. Today we have Karen. She is such an advocate for patients. She's a survivor herself. So, Karen, today we're talking about long-term effects of treatment. And we all know xerostomia, dry mouth, is a big one.
Mhm.
So let's start with that. What are your tips and tricks for dealing with dry mouth?
Okay. Hi, everyone. Um, I had my tongue cancer 9 years ago. So I've had dry mouth from day one of radiotherapy. Um, and I thought that once I hit sort of a year to 18 months after treatment finished, that would be how it was there, would be how it would continue. So it wasn't too bad. I had it. It was, I was coping okay with it. And then I think I got to about 5 years cancer free when my dry mouth got worse. Um, the dry mouth is really hard because obviously you've got very little saliva, and it's looking for things that you can use. Um, and you don't always get that information from the professionals within the hospital department. I knew about xylem melts and their lovely little disc that you put in your on your
What,
gum.
what's your favorite thing to use?
Mm. I'm very much between xylem melts and tablets that I finally managed to get prescribed by a GP called Saladin, at that pilocarpine. They're normally for dry eyes, but they work really well for dry mouth. But it's a tablet, and not everyone likes to have tablets. But obviously, within support groups, like we've got the Mouth Cancer Foundation support group on Facebook, we share all our the products so that we can all try different things through the gels and the sprays.
Right. I think
We
that the bottom line is that there is a product out there and don't give up on trying the various products. Um,
exactly.
my tip was to have a hydration backpack on my nightstand table, and the hose from it went under my pillow. And when I woke up with dry mouth, I would suck some water. And that was my big trick. But recently, I don't know if you've ever tried this, but I get on into child's pose. It's a yoga position where you've got your knees under you and you're on the floor. And I put something under my forehead to so my nose isn't smushed on the ground. And I find that saliva drips towards the front of my mouth. So
Yes.
sometimes when I don't have a water bottle and I start to panic, like, oh my God, I'm starting to cough, and it's not good to cough. We all know that. It's really bad for your vocal cords and for the whole system back here to traumatize it with coughing. I would get into this child's pose and I'd feel the saliva coming forward.
I hear you. I've just started doing some yoga um, through sort of signposting from dental professionals, and I'm finding that's really helpful for, not only for like the saliva, but for the mindset. Breathing exercises to helping calm me down when I'm not getting very far with all my other late effects, and
Hmm.
I'm not getting the necessary help and support. Um, I was advised to try a bit of yoga, and you know what? It's really helping. It's trying different things. Different things work for different people, don't they?
And we have a lot of issues that we could talk about. We could talk about intimacy, hearing issues, speech issues, depression, osteoradionecrosis, swallowing, too much, too little. So there are a lot of topics. If any of you listening want to put in the chat what you would like to discuss, please do so and we'll bring that up. But until then, Karen and I are just going to keep talking about, like, one of the things I have is ringing in my ears. It's from
Yes.
radiation, but it's intermittent. It goes away and it comes and goes, and I don't know what triggers it. There's nothing. It just happens. You
Yeah,
too.
I agree. When did your late effects start coming about, Eva?
After radiation.
Yeah, but did you have like you had the initial effects, and then did you start as the years went on? Did you start getting more late
Well,
effects coming about?
years went on. My saliva got better. My
Mhm.
sensitivity to light in my eyes got worse. I've also developed basal cell carcinomas in my radiated field. So, I mean, they can't prove it's from radiation, but radiation probably contributed to it. So it is important for you to check your skin in these areas. We could talk about eating. I mean, I can't do spicy. I find that my scar begins to itch, and the itch goes into my ear, and it's incredibly uncomfortable. So I just stay away from spicy foods. You know, I only chew on one side of my mouth. So
Mhm.
I I also have soft foods that I really love. I've gotten to really love pureed spinach and sweet potato. And I love pureeing stuff and then adding a little flavor or spice to it. You know, not spicy,
Okay.
but
Yeah.
yeah.
And what about pain levels? Do you have much in the way of pain?
That I'm glad you brought that up. Yes, I can get incredible pain in my neck. This side does all the work because I don't have a neck muscle here. So there are things that I do. Sometimes just raising my head to turn my pillow over or to turn over in bed, I'm like, oh, just felt it. And then I know I'm gonna have a headache the next day. I'm gonna have a neck ache. And it goes into my head and I basically catch it by taking Tylenol and Advil. And I can usually, really minimize the amount of the pain that happens. How about anybody else? Any questions or what it's like for you, Karen?
I do have lots of different pains, but I tried medication, but medication made it worse. I was finding I was having more side effects on top of late effects, and my quality of life got worse. I think this is something that there needs to be a conversation with professionals within the cancer pathway, explaining to patients that there are the possibility of late effects coming about, because until I reached 5 years, I had no idea that late effects actually existed. And I know, obviously, in the United States, there's very little support for aftercare, as there is in the UK. I know we have several late effects for head and neck cancer patients, but we haven't got enough. And we're not told enough about what we're experiencing. So there's that initial fear of recurrence. And there's just a real lack of support for patients. We really need to get more professionals on board in helping support aftercare.
With that,
Um, and with the partners as well, because our partners are severely affected by our late effects as well, and they're not even looked at with any of this. They just sit back and have to nurture and care for us. And there's an awful lot for them to do. I think there's trauma. There's a lot of trauma
right?
involved, isn't there?
Yes.
And I imagine that a lot of our patients that are on here tonight must be experiencing the trauma from all the different effects that they're
Yeah, I think
experiencing.
intimacy goes, it's just so important to openly communicate. And just it's hard. It's really hard to say, "Hey, I'm not feeling great today. My neck is really killing me."
Yeah.
Uh, it's hard. Jim, you mentioned something about your neck. So I have these packs that I put into the microwave. They're heat packs. They've got like rice or something inside. Oh man, those save me. I've got one that's shaped like the neck, and anytime my neck starts to hurt, you got to get on it right away with some Tylenol, Advil, and heat. But there are times at night when the heat just doesn't do it, and I'll actually use ice.
Mm.
Ice, an ice pack, not too cold. You don't want to hurt your skin, but the coldness really seems to help the pain that I'm feeling in my neck, which goes into my like head and it comes forward and comes to here. So it's not uncommon, Jim, and there are ways to to nip it right away. Any other thoughts or comments, please put it in the chat so Karen and I can respond to you.
I see that Sherry's put on there about have you got to a space where you're able to eat socially and talk while eating a meal without choking. That took a long time for me. I had to have speech therapy
I
to bring
highly
about my
therapy for
yeah.
everybody because I've learned how to protect my voice. I used to get hoarse very easily. I could say something and then all of a sudden I'm hoarse for a month. So I really traumatized my vocal cords. So some of the tips that I learned is do not whisper. Whispering is really bad. And coughing, of course, is really bad for your vocal cords. It's important to protect your vocal cords by speaking higher. Like, do you hear how I'm raising my voice instead of dropping my voice? When I drop my voice, I was taught that that makes those vocal cords bang against each other. So speech therapy not only helped me articulate sounds, R's and S's, but it has helped me protect my vocal cords. I highly
Yeah.
recommend it. How about you, Karen?
Um, I found speech therapy was really good for helping with strengthening my tongue before I had all the pain issues, but also really good for helping with confidence when eating out. My speech therapist gave me tips for um, working away, trying to think about stopping eating and trying to have a bit of a conversation, but taking my time, not rushing it
Right.
for fear of choking. But not everyone gets offered speech therapy. So this is when you have to advocate for yourself and push and say, I actually need speech therapy. Can we access this, please? In
That's good.
this in this pathway, we have to be our own advocates
So
and we have
something
to
else
push.
I highly recommend is massaging your mouth and neck. So when your fingernails are short and clean and you're in the shower, I recommend palpating your tongue. Give it a little massage, not harsh, just stimulating the blood supply. I also will stick my finger and pull my cheek out, give it a good stretch. I sometimes do it with my thumb. I'll do it like this way. I feel my cheek too. You know, it's really important for you to know what your mouth feels like so that when you feel something odd, you know to bring it up to your doctor. So don't be afraid to feel inside your mouth. I also like to massage my gums inside my mouth very gently with my finger. I'll go around and sometimes I feel something, a little bump. For example, I was doing a self massage and I felt in the valley here, like some crunchies. And I'm like, God, I don't remember if I felt that last. So I had an appointment with my hygienist and I asked her, what do you think those are? And she said, it's bone. I had no idea that there's sort of a crunchy, bony feeling down in here. So get to know your mouths, everybody, and feel around and massage. I mean, it feels good actually. And then I use that gua sha stone. It's sort of just this flat stone. And I go down my neck like this with some vitamin E oil. I mean, it just, my neck feels so stimulated. I think it brings blood supply to your mouth and it's important.
That's really good. That's really helpful to
Because the
know.
radiation dries everything up, stiffens everything.
Mhm.
And whenever you feel that stiffness come into your mouth, go for the massage.
Good tip, Eva.
Thanks. Are there tips? Any other thoughts that anybody has? Or
Yeah.
yes, yoga for the mouth, but yes, stretching. Thank
Yeah.
us. I mean, basically, I like to get an ice cream cone every once in a while to stick my tongue out and really lick it. It's hard. My tongue goes off to the side, and it's really hard to stick my tongue out. So I
Yeah.
like to try to challenge myself. But when I'm sitting in the car, for example, I push my tongue out into my cheeks. And it's very difficult. It's not easy
Mm,
for me. And I try to bring my tongue, do a circle with my tongue all the way around my lips, top lips, bottom lips. It's not easy and my tongue gets tired. But
I
those
bet.
are really great exercises to keep your mouth in shape.
Absolutely. I'm not able to move my tongue that much, so I can't stick it out. But I still try and do things. But but this is where we're also different with the type of surgeries we've had and different treatments. But we're all pushing through in the best way that we can, aren't we? And that's what we can do.
Right. And I think that telling your story like you're doing, Karen, like I'm doing, is a healing method. It's a way to really heal and know that everything you've been through is going to help somebody else.
Absolutely. And I hear from other patients about how they deal with things. This is a good thing about the support groups because people are able to share what works for them. Some people are able to have acupuncture or Botox, but a lot of patients aren't able to access all that if they're having to pay for it, which is really tough. A lot of patients end up having to go into benefits as more
Right.
and more of our patients are getting younger and younger. Um, some aren't able to keep up their jobs due to their late effects and are on benefits, which means they're unable to access things like the Botox and acupuncture. And I
Right.
can't access those. So that's why I've started doing the yoga. So
And
it's
I
just to
think
find
that
things that work.
And I think that I would like to leave everybody with the message that nobody is going to take care of you like you. So when you need to rest, when you need help, when you must ask for it or take that time for yourself because nobody's going to do it for you. And that is really the best way to overcome long term effects, so really from anything is to be kind to yourself. You've been through a lot, you've gotten through a lot, and now it's time for you. It's very easy for us to take care of others. It's a lot harder to say, I got to take care of myself, or at least it's hard for me.
No, I
So,
agree. It is hard.
our 20 minutes is almost up, and we love having this time to ask you what your challenges are. How do people cope with, can somebody read that chat to me? Dental issues? Is that what it said?
How do people cope with dentures?
Yeah.
Dent. Okay, the first thing to know with dentures is that you still need an oral cancer screening. Your oral health is different from your teeth. So they're going to still be looking at your tissue underneath the dentures. And well, with dentures, it's different for everybody. It depends if you have any teeth that you can attach the dentures to. So, but you deserve to have teeth and to look good. Everybody does. So I hope that you figure out how to use your dentures. And if you're not getting compassionate care from your prosthodontist, find someone who can give you the best care. Don't
Yeah.
feel like you're stuck with one person.
And please keep advocating for yourselves on this journey. Please keep being honest with your medical team. If you're having problems, any issues that don't feel right and you're worried about them, please seek help and advice. And we will help you as much as we can through support groups. But
Yes.
look after yourselves. You are important. Your partners are important. Your families are important. And they all deal with this like you do.
And the way you deal with it is going to leave a legacy to everybody who knows you and loves you about how to cope with life's challenges. And we're all going to have them in one way, shape, or form. And for Sherry, you asked about the wrist. It will, in time, it's going to be fine. You just gently have to continue to exercise and gently move it around. And I hope that you will regain complete use of it like I have. Thank you, everybody, for coming today. We'll see you next month. Don't forget to register, share this with your friends, and it will be online. So if you missed it, just go online and catch it. And Karen and I will answer your questions. We'll check on the YouTube
Yeah.
link and answer your questions. Goodbye, everybody. See you next month.
Thank you for listening.